my patients kind of ask me how it is that I came to be this nationally recognized expert on body contouring. My own mentor now tells me that my results are better than his. You know, I think it's because of the way I approach the issue. Again, I approach it from a very personal platform. I think to myself, what would I want? What would I seek if I were this patient? And then I design the treatment that way. And so UltraSculpt, which is my proprietary version of liposuction, which is modified and evolved from traditional liposuction, is far superior to traditional liposuction for several reasons. There are 3 physical reasons and 1 abstract one. The 3 physical reasons are, number 1, I do local anesthesia, not general. There's no reason to do general anesthesia when you're doing liposuction. There really isn't. You only would do general if the doctor wants convenience for himself, because it's not very convenient for the patient. It's more expensive, it's more risky. Nobody wants to be put out. Nobody wants to have vomiting like that patient that we saw complaining how she had so much vomiting, you know, after she had general anesthesia with her C-sections. So I do local anesthesia, which is safer and cheaper and allows for a better recovery for the patients. Then I use small cannulas. I don't use big giant cannons. This is what most plastic surgeons use. They use big giant cannons. Why? Again, because it's convenient for the surgeon. The procedure goes faster. He can do more cases in a day. But that's not very good for the patient. Giant cannulas cause a lot of tissue trauma, a lot of collateral damage. And that's why patients can end up with issues or problems or unnecessary pain and discomfort. When I use small little cannulas that are smaller than a coffee stirrer, yes, it means more work for me because I got to do more passes. But it also means I can be more accurate with my design of love handles and curves. And it also means that I can really respect the tissues and not damage surrounding tissues. So less trauma, my patient's safer and heals faster and better. So I don't use big giant cannulas. Think of it as like painting the wall. You can either use a big giant roller or you can use a fine little paintbrush. The fine little paintbrush may take longer, but it'll give you a more precise result. The third thing is I've never done just liposuction. I always have my liposuction with an energy device, whether it's the Smart Lipo Laser, the BodyTite, or now the new Quantum RF, which is the end-all be-all of skin tightening. Because lipo doesn't really tighten skin that much. In fact, if you lipo enough, you end up with more loose skin. So what's the point of that? Things are gonna look worse. So my patients always end up with tighter skin than they started with. Even if I suck out a lot of fat, that skin doesn't end up hanging. It ends up snatched up tight because the heat of the energy device gets the skin to contract in 3 dimensions, X, Y, and Z. The fourth thing is the artistry. This is the abstract portion of UltraSculpt. And that's just my technique, the way that I particularly do things. What I like to say is, imagine this. If you give 1,000 art students the exact same canvas, the exact same paints, brushes, everything that Michelangelo used to create his creations, will they be able to create the same creation like Michelangelo? No. Why? Because they're not Michelangelo. The artistry comes from within. It comes from within the artist. They have to be able to have the vision, the insight, to be able to design, to sculpt things the proper way. And that's not something concrete. That's abstract. It's IP, intellectual property. So those are the things that really set UltraSculpt apart from traditional liposuction. These are the things that make UltraSculpt safer, give my patients faster recovery, 24 to 48 hours, give my patients much more natural looking results where some of my patients told me their own mothers couldn't tell that they had done liposuction. What more can you ask for other than a nice, safe, fast, beautifully natural looking procedure?